How to practice self-care after narcissistic abuse. How can you practice self-care after experiencing narcissistic abuse? This question is vital for anyone on the path to healing from the emotional and psychological trauma caused by such abuse. Narcissistic abuse can deeply affect your self-worth, trust in others, and emotional stability. Therefore, intentional self-care is essential for recovery. Here are some effective steps to guide you through this healing journey. First, acknowledge the abuse and its impact on your life. Recognizing that you have experienced narcissistic abuse is crucial. This acknowledgement validates your feelings and opens the door to healing. Understanding that the abuse may have caused complex trauma symptoms, similar to post-traumatic stress disorder, is important. You might experience hypervigilance, emotional numbness, or intrusive memories. Next, prioritize physical self-care. Taking care of your body supports emotional recovery. Engage in regular physical activities such as walking, yoga, or gentle exercise. These activities can improve your mood and reduce stress. Ensure you get adequate sleep and maintain balanced nutrition to restore your energy. These practices help stabilize your nervous system, which can be affected by trauma. Emotional self-care is another vital aspect. This involves activities that help you process and regulate your feelings. Techniques such as journaling, mindfulness, meditation, and deep breathing exercises can ground you in the present moment and reduce anxiety. Allow yourself to experience emotions without judgment, which is essential for healing from trauma. Setting and maintaining healthy boundaries is also important. Narcissistic abuse often involves boundary violations. Learning to set clear and firm boundaries protects your emotional well-being. This means saying no to demands that feel harmful or overwhelming and limiting contact with the abuser if possible. Boundary setting is a form of self-respect and empowerment that counters the control tactics used by narcissists. Rebuilding trust and social connections is another step in your self-care journey. Abuse can lead to isolation and difficulty trusting others. Rebuilding a support system of trusted friends, family, or support groups provides emotional validation and reduces feelings of loneliness. Healthy relationships are characterized by mutual respect and support, which contrasts with abusive dynamics. Gradually engaging in social activities can restore a sense of belonging and safety. Seeking professional support is highly recommended. Therapy can be a crucial part of recovery. A mental health professional experienced in trauma and narcissistic abuse can guide you through processing the abuse, rebuilding self-esteem, and developing coping strategies. Therapy also supports establishing consistent self-care routines and addressing any symptoms of post-traumatic stress disorder. Rediscovering your identity and interests is essential as well. Narcissistic abuse often suppresses personal goals and passions. Reclaiming your independence by exploring hobbies, education, or career changes helps rebuild a sense of self beyond the abuse. Engaging in activities that bring joy and fulfillment reinforces your autonomy and self-worth. Lastly, practice compassion and patience with yourself. Recovery is a gradual process. Be gentle with yourself, recognizing that setbacks are normal. Celebrate small victories in your healing journey and remind yourself that self-care is a necessary and deserved act. In summary, self-care after narcissistic abuse involves a holistic approach that addresses physical health, emotional regulation, boundary setting, social reconnection, and professional support. These steps help rebuild trust, restore self-esteem, and foster resilience, which are vital for healing from trauma similar to post-traumatic stress disorder. Always consider personalized guidance from healthcare professionals to tailor self-care to your specific needs.